principal sticks his head in the door with a question. That night was the Hal Pafter basketball game, which was the major rivalry at the time. And there was an 8th grader, whom I got to know well, who was constantly getting in trouble, and not surprisingly that day he was suspended, but he's on the basketball team. So the assistant principal wanted to know if they should let him play that night, even though he was suspended. And Friedman got that very stern look that he often got, and he said, of course I'm making up the name, he said, Moshe is a mazik. He's a horrible human being. He will hurt, maim, and insult someone with no remorse and no regard for anybody's well-being. Just the guy we need on the team. Let him play. The other story I remember is it was a morning in the school, and a young boy who had been expelled from another school. Parents were coming, hat in hand, tail between their legs, asking if he could be admitted to Hal. And Friedman asked me to evaluate him, but he said he's going to be away that afternoon. I should call him that night to give him my results. I evaluated the child. It wasn't a pretty picture. The kid had a lot of learning disabilities, behavioral problems, not a healthy family. He really had the cards loaded against him, and the card decked against him. And so I did my evaluation, went home, I saw my private patients. It was late that night. I called Rabbi Friedman, and I gave him my report, and it wasn't a good report. And when it was all done, he was quiet at the other end, and it was that awkward sort of silence. I didn't know what to do. So I said to him, what are you going to do? And he said to me, and I'll never forget those words, with a heavy European accent. He said, it's night, and this is Dinei Nefashos. And we're not done Dinei Nefashos at night. In other words, the halachic imperative, that if you're making a judgment that's life and death, you don't do it at night. And to him, this was life and death. So it's really great. We're very glad to be here and participating in the tribute to Dr. Silver, who was the founder and one of the visionaries, who is responsible for the fact that Orthodox Jewry is so alive and well today with the YU basketball team creaming everybody. Who would have thought? Okay, so let me start, because we're going to talk about, I think the title, if I recall correctly, I might have here, right? No longer under the drug, children's emotional needs and well-being. And I want to talk about how undoing stigma of mental health, mental illness, and psychotherapy, and how it relates particularly to children. So I'm going to start by reading excerpts from a sort of piece, a diary entry really, written, and I have her permission to do this, written by a 15-year-old from our community, from the modern Orthodox community, who had made 3 suicide attempts. Now, again, I don't want to become alarmist. Suicide is still rare. It's not unheard of, but it's still rare among children, and most depressed people are not suicidal. Although most suicidal people are depressed. But I think it really captures what we're talking about. And by the way, let me take 2 things. She comes from the most lovely, wholesome, caring, intact family. And she's doing quite well now. It's a few years ago, and she's really doing well. But let me read to you what she entered in this diary. I continue my therapy and different medications as well. I still have tremendous difficulty with anxiety, depression, and OCD, but I'm working on it. I try hard at school, and I'm making new friends and becoming closer to different people. I'm still figuring it all out, and I am hopeful. I am so lucky to have the most amazing family who cares about me and can pick me up when I fall. I really love them. I want to share my story because I think that mental health is something people in our community don't really talk about. It's only talked about when some crazy shooting happens, which makes people think that everyone with mental illness is crazy. But that's not true. Mental illness is extremely common, especially among teens. If you met me, you would never realize I tried to kill myself. I am social, I get good grades in school, I dress normally, and I've never tried drinking, smoking, or drugs. I come from a quote-unquote normal family, and you would think I am a normal teenage girl. There are so many others like me, I'm sure. Mental illness is something we need to address as a community, and people suffering from it need to feel supported, not shunned. I would like to also talk about the tremendous impacts social exclusion and rejection has on everyone, especially on those of us with mental illness. My friends leaving me out of their group is something that hurt me the most, and after hours contemplating, I still don't understand why it happened to me. But it did. It can happen to anyone. Inclusion is something that the whole community needs to work on. Making the effort to reach out to someone can make that person's day. Why am I writing this? I'm sure that there are many other kids who are suffering from mental illness, exclusion, or both, and they feel they don't have a voice to speak or someone out there who cares. We need to bring these issues out into the open. Schools need to discuss this. Rabbis need to bring these issues into their sermons. Parents need to discuss this with their children. And friends need to be more supportive of one another. It may just save a life. And then let me share with you one other story. Maybe it's a little bit more amusing, but I think it also has a lesson related to this. Many more years ago than I care to think, I was referred a 14-year-old boy who had moved from another neighborhood and was coming for therapy. And in the middle of interviewing him, I realized that one of my kids, or I suspected one of my kids was his classmate. So I said to him, I think one of my children are in your class. He said, who? I said, Rafi Blumenthal. He goes, oh yeah. I said, look, if you don't want to see me, I'll understand. I won't charge you for the session, but I guarantee you everything is confidential. Nobody's going to know. If you want to continue, you have my word that I'll be strictly confidential. And he said, no, he was okay. He trusted me. Well, sure enough, the two boys become friends. And I'm putting on like a great performance. My son one day comes down, going to so-and-so's house. Really, I never heard that name. Oh, he moved here from, oh, how interesting, you know. Then he came to our house for Shabbos. I walk over, I give him a shalom aleichem, like I'm meeting him for the first time. I'm asking him questions at the Shabbos table as if I hadn't known him. And this is going on for the whole year, and I'm like, I'm proud of myself. I'm really something. The last session before sleepaway camp, after 9 months of this, he comes into my office and he just starts laughing. And he's laughing, and he's laughing, and he can't stop laughing. I kept saying, what's so funny? What's so funny? Finally he tells me, the day after our first session, he comes to school and he says, hey, guess what, Rafi? Your dad's my shrink. And the two of them agree not to tell me. So the whole year, I'm going through this whole performance, and they're having the time of their lives. Cute story, one more time in which I was outwitted by my children. But let me ask the question, are they really wrong? Really, are they really wrong? Why do you have to hide it? They went to the same allergist. You know, I mean, if one of your friends, your kid, you know, your friend, a patient of yours was a classmate of your child, well, you wouldn't have to hide it. Why should mental illness be any different? And it really isn't. Let's make a comparison. Okay, let's compare mental illness to medical ailments. Okay, let's take heart disease. All right, there are basically three factors that would result in somebody having let's say, a medical crisis, a heart attack, or something like that. First of all, there's family history. There's genetic loading. Anybody will tell you. Any cardiologist will tell you. We're honoring cardiologists tonight. Any cardiologist will tell you that a family history makes it more likely that you're going to have heart disease. There is environmental factors. You know, you have a sedentary lifestyle, you're sitting there eating too much kishka on Shabbos, you know, that'll combine to cause a heart attack. And you have heart disease, you have blocked arteries, you have arrhythmia, you have something. All those three factors come together, and someone can have a heart attack. Well, mental illness is no different. There is genetic loading for every single type of mental illness. There is a genetic predisposition. There are environmental factors. So there might be losses, there might be hardship, there might be some misguided parenting, there might be, or other traumatic experiences. And there's the presence of an ailment, the presence of an illness, of depression, of anxiety, of attention deficit disorder. And those of you who don't know what attention deficit disorder is, what's afflicting most of you now while I'm speaking, right? It's an inability to pay attention and focus, you know. But it was, that was, yeah, right. That was MTA, right? They forget it.
It's our specialty.
Yeah, right. But no, I'm serious. It was, you know, so there's environmental factors, genetic loading, the presence of an illness. It's no different. And by the way, I think it's important that I just mentioned this. We have to be very careful. If somebody's child is experiencing some sort of emotional difficulty, some sort of behavioral difficulties, then we don't start looking askance at the parents. At this, we have to blame our forefather, Sigmund Freud, because early theories of mental illness did very much focus on, call it mistakes, or bad parenting or something like that. We know very well nowadays that's not the case, and I can attest to it with over 40 years in the field. I know of families of children who are raised by, just like this young lady, by wonderful parents, effective, competent parents, and the kids have emotional difficulties. And I know some families where I wouldn't let them watch my pet parakeet, and the kids turn out okay. There's a lot of facts, especially today, and that's not our topic, but today, when there's so much impact of things outside the family impacting our children. Someone once said that the erosion of parenting began with Alexander Graham Bell. Because now somebody outside the home can impact the children. Imagine today with technology and social media and internet. But it's not, you know, if somebody's child has some emotional difficulties, has depression, has anxiety, has oppositional defiant disorder, any of those fancy names we have for the ailments, the parents shouldn't be looked at any different than if the child was diagnosed with cancer or with heart disease. It's not because of bad parenting. In fact, sometimes even when we see parents like not being themselves with a child, I come to realize that didn't cause the problems, because the parents had temperamentally had a very difficult child, so they get frantic or they get confused as to how to continue parenting, so they do sometimes some ill-advised things. But it's the other way around. It's the the cause is the problems with the kid, that they just don't know what to do, and therefore they're so drained from the difficulties the child is posing that they have some, then they engage in some behaviors that are ill-advised. But it's not the other way around. So we'd be very, very careful. And let me ask you another thing. I'll just give you as an example. Okay, we have some wonderful traditions in our liturgy and our daily tefillos to daven for the sick. So we have Misha Berach, right? Sometimes every day, sometimes on just Shabbos, right? We announce that when the Sefer Torah is taken out, we're going to make a Misha Berach for Cholim, right? We're going to make a Misha Berach for someone who's sick. And different people come up to the beam and they submit names. And you'll say, one of your friends goes up and submits a name. You ask him, why are you submitting a name? And he'll say, my parent was diagnosed with heart disease. My spouse, had a kidney stone. My kid fell and fractured his arm. Why can't you say, my father was just diagnosed with depression. My spouse was diagnosed with obsessive-compulsive disorder. My child has attention deficit disorder. Why is it any different? We'd say refuas nefesh, refuas haguf. Why do we have to be embarrassed? Why do we have to be ashamed? This is also an ailment caused much in the same way. And why shouldn't we be forthright about it? There's a very, very special couple just down the road from here. Philip and Ruth Roth, and so many of you may know them. If you don't, it's worth knowing them. Remarkable people, and they really don't mind my mentioning it. They lost a child, their son Jonathan, to suicide. And I teach a course, I teach a course of YU to the Smicha students on bereavement, and it's a very interesting course. What we do is, I have 1 week lecture, and then 1 week I bring in someone who had experienced usually an atypical kind of loss. So I have someone comes in who had a perinatal loss of an infant. We bring in people who had experienced early parental loss. My next visitor is going to be someone who experienced a sibling loss. And they talk to the guys, give them the first-hand experience of this loss. So the last class, I usually bring in Philip and Ruth, and they talk about the loss of their son Jonathan at the age of 21 to suicide. And Philip said something once, and it literally sent shivers down my spine. And I want to tell you what he said, and I'm going to tell you how somebody else responded to it. He said that if my son had cancer, I could have talked about it. And I could have asked people, I could have found out, did I have the best pediatric oncologist? Did I have the best doctors? And I could have had people davening for him. But because my son had a depression, had a suicidal depression, I had to keep it a secret, so I don't know if I had the best therapist or psychiatrist, and nobody was davening for him. And maybe that would have made a difference. And I once mentioned I was speaking in Baltimore, and speaking after me was Rabbi Ephraim Shapiro from Miami. And during his part of speech, he referenced this story that I told. He told the following story. He said that there was an almana, a widow, who had a son whom she sent to yeshiva in Eretz Yisrael, and he was having a very hard time in the yeshiva, a very hard time adjusting. And the yeshiva felt bad for the mother, for a widow, so they didn't want to tell her, so they didn't tell her. And they tried everything they could on their own to try to make it work for him, and it didn't work. And ultimately, they had to ask him to leave. So they called her to tell her that they're going to ask their son to leave. And they said, we're sorry, we didn't want to upset you. You have so much on your plate, your life's so difficult, we didn't upset you, so we didn't tell you. And she took them to a din Torah, took them to a rabbinic court. And her argument was, had they told me, I could have davened for him. And the davening of an almana goes right through the gates of heaven. And maybe my davening would have made a difference. And the Rabbanim of the Din Torah agreed with her and forced the yeshiva to take him back. That's what stigma does. And we have to get rid of the stigma. And by the way, it was mentioned that she'll talk about learning disabilities, and the same thing applies to learning disabilities. Learning disabilities are usually, again, the child who has problems in specific areas of instruction. And again, it's not bad parenting, it's not bad schools. It's just one of those quirks like any other ailment or illness. It's some idiosyncrasy of the central nervous system, that the child can't process language. They do great with math and they can't do language. Or they can't do math and they're great with language. Or they can't do auditory learning, but they're great with visual learning. I remember one girl, even back in my HAL days, who I picked up had an auditory learning disability. So processing through the ear was difficult for her, but she was great with vision. In fact, I'll get to that later. Sometimes they overcompensate. And I remember telling the teacher, and she said, it's interesting. I was teaching her Yoshua and had a map of Eretz Yisrael on the board, and she came to life. And she was processing visually. It's not anybody's fault. And I want to tell you, this is, again, the problem with stigma. I started a program in the 5 towns, in Nassau County. I'm sure you've heard of it, called Kahal, where the schools together provide special ed classes for kids with learning disabilities. And I've observed over the years, and we're close to 30 years in existence, the kids we get in kindergarten, most of them by 3rd or 4th grade are mainstreamed. The kids we get in 4th or 5th grade, and the parents don't want the children apart from their friend, they don't want the children in a different school. They're there, so let's get a shadow, let's get a tutor, let's do this. The ones that come in 4th or 5th grade, some of them never mainstream, and others it's much harder. So again, we have to get rid of the stigma, and we have to intervene early, because the earlier we intervene, the more effective we can be. Let me talk a little bit about psychotherapy, because it's important. Sometimes I hear all sorts of things about psychotherapy. One of them is I don't believe in therapy. So one of the answers I say to people when they say they don't believe in therapy, let me ask you a question. Do you believe in dentistry? Do you believe in podiatry? When did psychotherapy become a religion that you believe in or you don't believe in? I understand the answer. It used to be psychotherapy was this amorphous kind of skill that was very dependent on the practitioner, but it's changed a lot. Today, much of what we do is evidence-based. There's research. We have articulate techniques that are taught no different than medicine. And I want to tell you, I don't know if there are other professionals who go for so much postdoctoral training and are so busy with peer supervision groups as mental health professionals are. Maybe because of the complexity of the work we do. But it's training. In fact, one of my favorite things I do is sometimes everybody else says they're a therapist. Every plumber comes to my house, they're all therapists. Oh yeah, I'm a therapist also. But sometimes when I'm in really lousy mood, I'll say to them, great, let me run some cases by you. And I make up, obviously I don't say real cases, make up some of the cases. They never say it again, but it's a real technique. And I think we have to appreciate that. You're sending someone to a professional. Now, again, granted, like in any field, there are the really good ones, there's the so-so ones, and there's some bad ones. And there's different levels of training, and there's no question about it. And you have to be selective, have to be careful. In fact, NEFESH, which is the International Organization of Orthodox Mental Health Professionals, is establishing standards. It's not applicable here, but there's some neighborhoods now where people are just getting these quick degrees and calling themselves therapists. So there have to be standards. But a reputable, trained mental health professional is a professional and has techniques that they can master. And sometimes what I'll hear is, well, it's all in the Torah. It's all, we just have to love the child more. We have to give them, let them do yoga or something like that, and they'll be okay. Or we'll go to the health food store and get different vitamins, and we'll get the medication in a minute. Now, there's some truth to that. We certainly know, there's certainly a healthy body of research that shows that religious people do combat mental illness better than those who don't, or have lower levels in some areas of mental illness. I wish, in fact, sometimes I'd love to see, my professors, when I went to graduate school, could see this, because at the time when I went to graduate school, there was this very strong anti-religious sentiment in the field, and it was still very Freudian at the time. So how does that fit? So I'll tell you what I tell the guys at YU, that I tell the future rabbis. We shop nachas now to see them in their positions. But I'll tell them it's a little, again, I use the heart disease metaphor. If somebody has a heart ailment, someone has a heart attack, they have to go to the cardiologist. They have to be treated by the cardiologist. Once they're treated by the cardiologist, there's a lot they can do to stay healthy. They should see a nutritionist and be on, again, healthy food. They should exercise. They should not have a sedentary lifestyle. They should do different types of methods and techniques that lowers blood pressure, whether it's yoga, relaxation exercises, meditation, or something like that. All that's important. And the same thing is true with mental illness. If somebody is depressed, there's no question that learning Sifrei Musar or learning Chumash and learning about the travails of the Avos and how they triumphed over them is helpful. It's not the treatment. Once the congregant or the student is in treatment, yeah, set up a Seder with the person. Make sure the person's going to the Daf Yomi. That's going to help. That's like the exercise for the post-cardiac patient. But it's not the actual treatment. And by the way, same thing goes with parental counseling. You know, there's a certain way you parent a child who has anxiety, which is different than the way in which you parent a child who doesn't have anxiety. I don't want to bring up extraneous topics, but my most recent, if you will, phone groups, etc., was about the coronavirus now, about how to explain to children, how do you teach hygiene, how do you give them a proper perspective in the response. And one of the things I have to talk about is, depends on your kid. If you have a kid who's anxious, then you have to calm him down. But you can have a kid who's not anxious enough. You know, the daredevil, the kind of kid who doesn't like to be made, and that kid you have to make him anxious. So you have to tailor to the child. So if you have a child with ADHD, if you have a child with depression, you may have to parent him differently, and then maybe you do have to read some of the parenting books, and maybe you do have to talk to an expert on how to parent that child. But that's not the treatment, that's part of the recovery from the mental illness. In fact, there's it would be remiss if I didn't quote the Rav, but there's a very interesting insight from Rabbi Soloveitchik in his class. It's not his book, but on the book Ala Tshuva, which is a collection of his Tshuva lectures to the RCA over the years. And he says at one point in one of his lectures, he said he once met a psychiatrist, and the psychiatrist said that if he could change anything in the liturgy, he would want to change the V'chein tein pachtacha. You know, Hashem should give us fear. He said, there's so much anxiety out there, why should we ask Hashem for fear? So the Rav goes on and says he's not a psychiatrist, but he thinks he doesn't get it. What does V'chein tein pachtacha mean? He said, Hashem, give us the one fear that heals all other fears. Give us the Yiras Shamayim. Give us the fear of Hashem. And if you have that fear, then it will obviate all the other fears. And that's a V'chein tein pachtacha. So all this is important. And it's preventative and it's part of recovery. But it's not the actual treatment. Now, let me bring up some of the problems that are associated with psychotherapy. And then if we have some time, we'll take some questions, etc. Try to answer them as best I can. First of all, the money. You know, there's a Rav in my community likes to say, you know, it's money is an issue. Money is very difficult. So it's costly. I remember the very first Nefesh conference that we ever had. Nefesh, again, is the international organization of Orthodox mental health professionals. I was one of the founders. I was chairman of the first two conferences. At the very first conference, our posek is Rav David Cohn. Rav David Cohn is brilliant, a genius. I mean, he's got an encyclopedic mind, and he's the posek for Hatzalah in Brooklyn, he's the posek for Ohel, and he's the posek for Nefesh, so he has the mental health emphasis. And at the very first conference, he told us the following story. He told a story about Rabbi Yisrael Salanter, who once stayed in an inn. And as he was leaving, he was talking to his Talmidim, and he was telling them about the innkeeper, and so special, he gave us a bed, and he gave us a room, and he gave us a meal, and it's a tradition of Avraham Avinu, his Achnasas Archim is so special, and he's going on, and finally one of the Talmidim said, yeah, but we paid him. He said, that's his parnasa. And I thought it was very good, because I have to understand, and I don't know if you're going to preach it, very hard for us to charge money. You know, it's very hard. I don't know if I should be telling this story here in front of an Oren Kodesh, but early in my field, I was really wet behind the ears. One of my first patients that was referred to me, I think it was my internship, was a very expensive Zona prostitute. And she used to constantly compare our professions, which made me feel like really corrupt. But one of the things I won't say the other things she said, but one of the things she said was that you have to pay for something you should get for free. You know, it's hard. You know, chesed should be just given. You shouldn't get paid. But the reality is, if us mental health professionals weren't paid, we wouldn't do this. We also have yeshiva tuitions. I remember there was one point in my career where I had 4 jobs. I was working, maybe it might have been HALP, I think, I don't remember, but YU, and I was working at OHEL and at a private practice. No, it was also like, I don't remember, it was different points. And some people would say to me, you have 4 jobs. I said, yeah, one for each tuition. We have to live as well. But it's expensive, and it's one of the problems people confront. People tell me even, School principals in school will tell me I can make referrals, but it costs a lot of money. So let me address that. First of all, people make money on therapy. If you're healthier, if you're doing better, then you're going to save money. Like I said with Kahal, if we get the problems quickly, they can be remedied quicker. Also, this stereotype that used to be the reality of this once weekly therapy for years and years. There was a movie once, a Woody Allen film, it's called Sleeper, and he fell asleep for 200 years. And when he woke up and he realized he slept 200 years, he said, maybe by now I would have finished my psychoanalysis. Those days are over. We have very directive techniques. Doesn't have to be weekly. We give homework, we work with schools, we try to, there's a real effort to streamline treatment because it's difficult, it is very expensive. Not all, many therapists like myself, we have Masir Zmanim, we dedicate a portion of our practice to see people at low cost. I will tell you, because nothing gets my Irish up more than someone who never refers to me, sends all their wealthy congregants or patients to another therapist and then calls me and asks me to take a low-cost one. I won't do that, but if somebody regularly refers to me and calls me and says, listen, I have this one congregant, they can't afford it, yes, I will see them low cost. There's very little insurance coverage for private practitioners, but clinics do take insurance and clinics do work on sliding scales. You have the Jewish Family Service, I know here in Teaneck, probably in other areas here as well. And yes, it's a luck of the draw. You don't get to pick your therapist. And very often the therapists are younger and less seasoned therapists, although sometimes they have sometimes someone who just doesn't want to bother with a private practice, just wants to get paid. But for the most part, they're younger therapists. But the research shows that younger therapists seem to have as much success as the more seasoned ones. It seems they compensate with interest and effort what they don't have yet in experience. So you can still get some good treatment, and there should be gemachs. There should be charitable funds to help pay for therapy. However, I will say, and again, this is something important if you're going to do that, one of the things that I've learned to be careful about is that if a Bikur Cholim, or I'm going to just reference what's in our neighborhood, the Davis Memorial Fund, calls up, there's other funds that specialize in funding therapy. And if one of them calls to offer, to pay for therapy, I ask them right away, how much are you committing? For how many sessions, or how much? Because one of the problems that was happening is that a gemach would come along and say, I'll pay for the therapy. 3-4 months into the treatment, and they say, oh, we can't pay anymore, and now I have to see the patient for free or at practically no cost, because once you started, I can't stop the treatment. So that's how it should be structured. And by the way, one more viable alternative, not for everybody, but for many people, and children as well, is group therapy, which is not as expensive, and the research shows that group is as if not more effective than individual psychotherapy. So there are ways to get around that issue in terms of money. Another issue that comes up a lot is, should the therapist be from? Can I have my child seen by a therapist who's not from? Today in New York, I don't think this is so much a question. I think every third Orthodox Jew is a mental health professional. But Relief Resources, which by the way is a good place to know about. Relief Resources is an organization that just makes referrals to mental health for the Frum community. It's more sort of leaning towards the Haredi community, but they will offer, they'll make referrals for anyone. But again, shows you how mental health has come of age in the Orthodox community. But Relief Resources says that, last time I spoke, and there might be more by now, they say there's 1,500 from mental health professionals in the New York metropolitan area. And since there are only 1,300 Orthodox Jews, that's pretty impressive. But there really are some excellent, and today, Baruch Hashem, where department heads, we're leading professionals. You go to Nefesh, it's mind-blowing. Just to give you an example, the leading expert on the genetics of mental illness, Dr. Gerson, who is the head of the chief psychiatrist at the University of Chicago Medical School, is a firm guy. When he speaks at American Psychiatric Association, you can't get into the room. He's like the last word. So we have some really top people in the field. But let's say whatever, you have to go to a clinic, or you can't afford, or the person that seems to be best suited for your child is not a frum person. Do you have to see a frum therapist? So there's a very famous tshuva from Rav Moshe. And Rich Ramosha Feinstein says that whereas for medical care you can go to anyone, he says for mental health you should go to someone who's a Shomer Torah mitzvahs And if you live out of town, there isn't anybody, then you should have an agreement that you don't speak about religion. I remember many years ago, when I was just starting in the field, I was in a small shul, and the rabbi, in his sermon, referenced this famous tshuva from Rav Moshe. So as the only mental health professional in the shul, I felt I owed him a thank you for this gratuitous endorsement. So I went up to him after davening and I said, Rabbi, I just want you to know that we in mental health feel the same way about Rabbanim. We feel that you have to talk to a rabbi, he really should be someone who's a Shomer Torah and mitzvahs. To which he responded, that's probably harder to find. But I often wonder, and I can't comment on it, but I often wonder if Rav Moshe was alive today, would he say the same thing? Because Rav Moshe lived in a time when, again, psychoanalysis was the dominant theory. Psychoanalysis inherently is a heretical theory, and there was much more personal kind of treatment. It was less, sort of manually driven or more dictated type of treatment. But again, as I said, if it's certain types of issues, or certainly the person is going to be getting involved on a personal level in the person's life, it probably is preferable that the person should be someone from the Orthodox community. If you can do it not, it's a halachic question, that's what you should know, and should be really directed to your Rav. Medication. Medication gets a bad rep. And let me talk a little bit about medication. Again, is it true that sometimes medication is being used too much? Is medication overprescribed? Perhaps. But medication has significantly enhanced not only our capacity as those of us who don't prescribe medication as psychotherapists, but it has also enhanced the well-being of many of our children and adults. Let me start with antidepressants. With the onset of Zoloft, or what we call the SSRIs, we can treat depression. We don't cure it, but then again, physicians don't cure most ailments either. Most medication in medicine is to take care of the symptoms, not a cure. I just was diagnosed with something relatively harmless but painful, pseudo-gout, I think is called, in my arm, and my doctor said he can give me a cortisone shot, and I'll be back in 6 months for another one. It's not a cure. I decided to live with a pain. I'm a child Holocaust survivor, so I love pain. But it's so the same thing with medication. So the medication may not be a cure, but let's say, as I said, the SSRIs are very effective in treating depression and relieving depression and elevating mood, and with very few side effects. I came into the field when there were triglycerides and MAO inhibitors had very severe side effects. MAO inhibitors, if you ate a certain type of cheese or drank wine, you could have a stroke. I mean, it was very serious. Today there are medications. And a well-medicated psychiatrist medicates well, doesn't get rid of depression, just takes the edge off of it, because you need the depression for the work that we do. I don't want the person to be just giddy and happy. And the same thing with anxiety. I want the anxiety reduced so I can work on their anxiety. Not that such levels of anxiety that's crippling and we can't deal with it. And then, let me get back to the ADHD and the issue with the stimulant medication. People are very hesitant, and I understand that. And there are side effects, not terrible. There are side effects, and the question is, why do I have to medicate my child to fit into school? Why doesn't school adjust to my child? And that's a legitimate argument. But the reality is, and we're not changing the world, we have one type of school. And we have one type of school in America, we have one type of school in China, we have one type of school in Sri Lanka. Is you sit behind the desk, you look at a teacher, and the teacher's talking to you about something that's not terribly relevant to your life. And now I can imagine a type of school where a kid with ADHD will do very well. We're not sitting behind desks, where they're able to move around and jump from one thing to another. That's not the reality. And there's side effects to not fitting in. There's side effects to not being able to sit still in class. Because if you don't take care of it and you don't remedy it, it affects your self-esteem. You identify yourself as a loser, as a lo yitzlach, and then you'll be that even when you don't have to be. And by the way, there's social ramifications, because social skills are learned by focusing on the response your behavior has on the other person. And if you can't focus, then you can't socialize. And then you'll learn social skills and basic social skills. So there is a place for medication. By the way, I think things may be changing. I think schools now, again, it's not our topic, but due to technology now, the classroom's changing. And it's nothing out of the ordinary now to have a class where there's half the room is computer monitors, and kids are coming one by one to the teacher and going back to the computer monitor. That's tailored more to the child, the ADHD child. That's heaven. And by the way, you should know that some of the most, I don't know how it is around here, but in the neighborhood I'm in, some of the most successful businessmen, and particularly people who invest in the stock market, have ADHD up to the gazoo. But now they're not sitting behind desks. Well, two things happen. First, they're not sitting behind desks. So they can jump around and run around and scream and yell and, you know, show up with 2 different pairs of socks, you know, and, you know, and they're doing well. And very often I end up seeing their kids, and they remind me how I was a much better student than they were, but they're making 6 times what I'm making, and they're right. And the other thing is also, they all have secretaries. You know, I often say, if you could take an ADHD kid and send them to school with a secretary, they'd be great. They all have these like very rigid secretaries who remind them when it's their anniversary, remind them, you know, who they keep their appointments, you know, who you know, tell them that they check whether they brushed their teeth that morning, you know. So if we could send kids to school with secretaries, they'd be great. But again, they do very well. Now, the other question that comes up, I just want to make sure I'm doing time-wise. Oh wait, we have a clock there. Okay, a few more minutes, and then we'll take some questions. If a child needs medication, I go to a psychiatrist, I go to the pediatrician, I go to the internal medicine guy, I go to the neurologist. Unfortunately, despite all that we know, there's still not what we call parity in mental illness with physical ailments. The insurance companies will not reimburse, except for the very severe. And one contribution of Obamacare is that the severe mental illness, the schizophrenia, bipolar, which are really medical ailments, now will get reimbursed on par with other medical ailments, but anxiety, depression, these ADHD, these ailments are not being reimbursed on par, and insurance companies have 2 different tiers of reimbursement, and it just makes no sense. And unfortunately, you will get reimbursed for a medication visit to your pediatrician. You will not get reimbursed necessarily, or there'll be a very high deductible or different reimbursement rates for going to see a psychiatrist, and psychiatrists are expensive. Now, on the flip side, the medications today are so easy to prescribe that many of them can be prescribed by a general practitioner. Depends how complex the situation is. The other thing that I have observed over the years is that I find that the general physicians, let's say the internal medicine guy, the pediatrician, it takes longer to get the right dosage. They're not as at home with prescribing these medications, so they do it more gingerly. They enter it more, so it takes a little longer, whereas a psychiatrist with their more regular experience can right away sort of more pinpoint the proper dosages. But it really is an issue. Okay, let me talk about the topic that I often say I didn't learn enough mental illness to deal with, but I'll address it anyway, and that's called shidduchim. Okay, question I get almost on a weekly basis. I know it's not necessarily your kids yet, but it's going to come up pretty soon, okay? But a call I get almost on a weekly basis. My son's dating somebody, the mother has depression. Should I be concerned? My daughter's dating somebody. I know that he went through a period in his adolescence where he had to be treated for obsessive compulsive disorder. Should I go ahead with the shidduch, etc.? So I'm going to tell you my answer, and then I think it has ramifications in general for the issue of mental health. Let me ask you, who do you want raising your child or your grandchildren? I'll give you 2 choices. One person had a picture-perfect life. Never had any difficulty, just sort of walked through the raindrops. Had all the money in the world, got into the best seminary, BJJ, JBB, DDT, all the top title, all of them sound like text messages, all the top seminaries. Married the second guy she ever dated, everything went her way. Or someone who had some difficulties, had some challenges, faced them, and triumphed over them. Who's going to be a better parent for your child? Who knows what life dishes out? And I say to them, my question is, she had depression, did she go for help? Did she deal with it? Not only is she okay, she's better than good. Because she understands, she has more personal insight, she faced difficulties, and she triumphed over them. That's who I'd want raising my grandchildren. I'm not saying right away everybody should now send their kids for therapists so they got a good shidduch. But let's keep this in mind. That's what's different. Not having any. I want to tell you that when you get to that point, and you hear about somewhere if your kid's down now, you're going to do it through. We have all these different methods, but your kid's dating someone who never had a problem in their life, run for the hills. That's not a person who has a whole lot of resilience. And the other thing, and this is very important to understand, that, and that's probably where mental illness differs from physical ailments, is that there's a very thin line. Well, let's put it this way. Most of what we consider, I'm going to putting aside the very severe disorders, like I said, schizophrenia, bipolar, or something like that. But when the other ailments, properly channeled or managed, are really strengths. As I said, there's a very thin line between being depressed and being sensitive. There's a very thin line between being anxious and being ambitious. Even now, I said with this coronavirus, where folks, we want our kids to be anxious. We don't want to be too anxious or too unanxious. We want them to be all of us have the right level of anxiety. But anxiety is good. It motivates us. There's a very thin line between an interesting diagnosis, it's called oppositional defiant disorder. It's the kind of kid, or whatever you tell them, they have to do the opposite. It's interesting, I was just in Boston a week and a half ago, and I was speaking about a similar topic by David Hellman, and I have a cousin there, an older cousin, my father's older sister's oldest child, and I mentioned oppositional defiant disorder, and we were going to him for lunch, and his wife says to him, I finally have a diagnosis for you, you know. but you know what? A lot of these kids who are so oppositional, and let's put it this way, there's a very thin line between being oppositional and being creative. They think out of the box. I don't know how many of you know the story about Natan Sharansky. You know who Natan Sharansky was, this 5'2" Jew who took on the whole Soviet Union. And his wife, Avital, fought for him, etc. And finally, after years and years, he was going to be let, Reagan intervened, and they were going to let him go. And they brought him, this is back when it was in East Berlin and West Berlin, and they brought him to a bridge. The KGB brought him to a bridge, and he was in handcuffs. They took off the handcuffs. The other side of the bridge was his wife and the Americans, the Israelis, everything he was waiting for. And the KGB agent said to him, now walk straight across the bridge. Anyone want to take a guess what he did? He walked in a crisscross. Till the very end, he wasn't going to do what they told him to do. That's an oppositional defiant disorder, and he's one of the great heroes of our times. There's a thin line between being ADHD and being energetic and driven, as I said, some of the best businessmen. There's a menahel in our community, principal of a yeshiva Darchei Torah, a Mochareди yeshiva, but a very successful yeshiva. And its principal, he says this to me all the time, I don't think he'll mind saying, right, Bender, he does 18 things at one time. He's constantly running, and every once in a while he'll see me and he'll say, Blumenthal, good thing you did. Put me in the middle, this whole place will fall apart. Then he runs off, You need that. So a lot of therapy is not changing the person, but taking these very same characteristics, giving them mastery over it, and letting them use it in a constructive kind of way. I have a line I use with my patients. I say, I'm not going to change you. I'm going to make you better at who you are. And that's what a lot of therapy is. In fact, I'll tell you a personal story also, a very interesting story. Early in my career, I was working in a drug facility called Project Outreach. It was in Franklin Square, Long Island. It was an LIJ satellite, and it had two departments. It had those who were doing the real classical drug treatment, and then I was in what they called prevention, which was really just outpatient psychotherapy. But the idea was if we treat these people with depression and anxiety, then they won't abuse drugs. Then crack hit the street. And next thing you know, we were just deluged with substance abusers, and the prevention department was shut down, and we all had to do substance abuse treatment. We all had to do addiction treatment. Now, I'll tell you something. Got all sorts of faults and foibles. Addictions aren't one of them. I like to take a drink occasionally. I've never been drunk, never did drugs, I never gambled. It's just not my person. I don't have that DNA. And I had to treat substance abusers. It was very foreign to me. So you know what I did? I have this disgusting habit. I have it ad hayom hazeh. It now has a fancy name for it. I pick at my cuticles. I'm constantly scratching. I don't even realize I'm doing a Shabbos sometimes. I find myself doing it, pulling off my cuticles. It's a very disgusting habit. And I looked at it and said, oh, that's an addiction. I'm doing something, I can't stop it. And through that, I came to understand addicts. But that's, again, it's part of the human condition. Okay, two more points. Okay. Jokes. Humor is wonderful. I use it all the time. Humor, believe it or not, there's research that shows humor is a wonderful way to heal from depression, from trauma, because if you think about it, let's dissect the joke. What makes something funny? A typical joke is you lead someone one way, and then the last second comes a punchline. It's like a surprise. Humor is irony. Trauma, bereavement, setbacks are, you're going to work one morning, you're supposed to have one day of work, and then airplanes are crashing into your building. It has an element of humor in it. That's why Yitzchak is named Yitzchak. Because a 99-year-old person giving birth, that's funny, if you will. That's ironic. So humor is important, but not humor at the expense of someone else. And that's very important. And we have a very bad habit in our community of teasing people or making fun of them. And I want to just suggest, we love jokes about mental illness, about how the therapists are crazier than the patients and all these kinds, we love those kind of jokes. If you're going to make jokes about mental illness, only if you make jokes about cancer. Or if you're going to make jokes about ALS, then you can make jokes about mental illness. But it's not funny. It's not funny for those parents, for those families who are suffering with a child with mental illness. They're suffering. It's a huge hardship. And when you make jokes about it, you're aggravating the stigma. So be careful when you make these kind of jokes. And another thing I'd like to get rid of, one of the sacred cows of Judaism that I think we have to rethink, is a concept called nachas. And we're supposed to get nachas from our children. In other words, that basically having children is a business deal. We get these kids, we put in a ton of work on them, and then they're supposed to give us nachas. Avi steht, who says? Who says children were born in this world to give us nachas? Well, so our job is to parent them, to raise them as best we can. They don't owe us anything. That's not the deal. It's not a business deal. And therefore, it happens that sometimes some people are very fortunate, and they do have kids who bring them a lot of joy and nachas, and others have kids that are just very difficult, and not because they're bad parents. And as long as we're constantly focusing on nachas, and you get nachas, it's making it harder for those who have children harm, those with developmental delays, those with learning disabilities, those with psychiatric ailments. And we have to rethink this, because I really don't think that's why we have the mitzvah of Periyavariv, so that we should get payback through nachas. Okay, let me conclude with just one more sort of reiteration, if you will, and then a story that I think is relevant and helpful, which is Hashem, if he wanted to, could have made the world that we have no hardship. He could have made life easy, right? He could have made it, but he did. In Gan Eden, we blew it. But, he could have made that we have no problems with parnasa, that our kids are just picture perfect, nobody gets sick, there's no coronavirus, there's no political upheaval, there are no wars. He could have made the world that way. But he didn't. He made the world with hardship. And we don't even have to look at our own lives. Go through Sefer Bereshis again. Not one of the us had an easy life. They struggled. Not one of them had it easy with their kids. They had many problems with the children. And obviously Hashem made the world in such a way that we should be challenged, that there should be difficulties. And the question is not to try to dream and wish, and we can dream, but not to expect to have a carefree, unencumbered life, but what we do about it and how we handle it. And we're talking about just this one area. And I want to tell you something, that people sometimes ask me how I can do so much work in, let's say, trauma and tragedy and bereavement. And one of the answers I give them is, along with the bereavement and the pain, I see tremendous resilience and strength. And that's what we have to do. Hashem gave us not only the difficulties, but he gave us the wherewithal to take care of it. One of the stories that I was very moved by, the story I heard from a cousin of mine. My second cousin, Shemi Beagleisen, Hashem Yikom Damo, was one of the victims in 9/11. He was technically a second cousin. To me, it was almost like a first cousin, because my mother's a survivor, and they were just about the only relatives we had. And his almana told me the following story, that when she was sitting Shiva, another almana came, another woman who lost her husband just like she did, very suddenly. In her case, it was a stroke or heart attack, some sudden death. And she told her the following story. She said, as soon as he died, there was this big commotion. Of course, she was notified. She was horrified. No sooner had she figured out what happened, they had the funeral, they had the burial. Then came the Shiva, and of course the Shiva was Grand Central Station. There were people in and out all day. It was a huge commotion. And the final day after Shiva, her mother said to her, look, I'm taking the kids. You're exhausted. You need to sleep. I'm going to take the kids. She had young kids, and you get a good night's sleep. So that night she collapsed. She went to sleep. She woke up the next morning around 7 in the morning, and suddenly dawned on her what happened. And all the grief and the horror and the worry of it all just kept cascading into her. She said she was just finished. She was destroyed. She said to herself, I'm staying in bed. I'm spending the rest of my life in bed. And that's what she did. She stayed 8 o'clock, 9 o'clock, 10 o'clock. By 11 o'clock, she had to go to the bathroom. I mean, you can tell she was a young woman, because we would have gone to the bathroom 8 or 4 times, right? But, she said by 10 o'clock, she had to go to the bathroom. She said, I'm not going to wet the bed. So she got up and she went to the bathroom. After she went to the bathroom, her eyes were kind of crusty and some drool on her face, whatever. She didn't feel so good. She said, I'm going to wash my face. So she washed her face. And she noticed her breath was kind of bad, and her teeth were kind of filmy, and she didn't feel it. It was uncomfortable. So she'll brush her teeth. So she brushed her teeth. It says by that point, she had gone to the bathroom, washed her face, brushed her teeth. She couldn't go back to bed. And then she had what we used to call Yeshiva an Einfall. She had a huge insight. She said, you know what? Hashem could have created us that we don't have to go to the bathroom. We don't have to wash our face. That we don't have to brush our teeth. But he created us, he anatomically programmed us that we have to get out of bed in the morning, that we have to go to the bathroom, we have to wash our face, we have to brush our teeth. So he made us in the guf that we have to get out of bed. And that's how she got out of bed in the morning. So that's my parting message is, Hashem gave us hardship. He gave us children with difficulty, he gave ourselves with setbacks and pain, etc. He also gave us the wherewithal and the strength to take care of it. And we have to do it in a forthright manner without any shame and embarrassment. And we truly will have nachas, God willing, from all of our children. So let me conclude with that. Should I take questions? And okay, what did I forget? Any rebuttals? Any lawsuits? Larry, okay. No 63rd row. Yeah.
No. I won't go back to our past.
Okay.
Well, you should be proud of it.
Okay.
Talk about stigma. I assume that when you have a family, let's pick some mental illness, let's talk about something severe, significant, like suicide.
Yeah.
Someone tried to commit suicide.
Right.
How do you deal, I assume, I don't know if the word is insist or recommend, how do you deal with the siblings? You're dealing with a brother and a sister, for example, a boy who's going to go to the basketball team and all of his teammates are going to say, did you hear what happened to Chaim's sibling, whatever. I mean, that stigma, how do you deal with the siblings?
Sure.
What do you tell the siblings, and how are they supposed to get through it? These are not adults. These are other teenagers, or even younger.
Look, we had, in Englewood, not so long ago, a suicide of a 10-year-old. And the parents, the day, said, I want this to be publicized, I want people to know. And we did a phone group with thousands of people on the phone.
You insist on the siblings coming in?
Okay, so let me explain to you. So the question again is about, what about the siblings of someone who dies of a suicide? By the way, let me just say that this, and I'm not faulting you, nobody knows this, but very few people know it. The suicide survival community is urging people to try to get away from using that term commit suicide. We've been saying it for years, it's hard, because you commit a crime. It harks back to when suicide was seen as a crime. So therefore we talk about dying as a suicide or a fatal suicide or taking one's life. Again, that's a whole topic unto itself, but again, suicide is no different than any other medical ailment. There's genetic loading. In fact, interesting enough, there was an article that appeared in the American Journal of Psychiatry a few years back that showed statistically, because you could say, well, most people who die of suicide are depressed, so maybe it's the depression that's transmitted genetically. But if somebody has a parent who has, let's say, anxiety and dies of a suicide, and the child has depression, there's still a greater likelihood that the child will take their life. That suicide, independent of the mental illness, seems to have a genetic component. I suspect maybe it's a cluster of genes, maybe some cluster of depression overlapping with impulsivity. But there is a family loading. There is, in 95%, roughly, of suicides is a diagnosed mental illness. So again, it's the same thing. And they're environmental stresses. So you have it just like any other illness. And just like in some illnesses are painful, but you don't die from them, like let's say rheumatoid arthritis, there's some ailments that you can die from, such as heart disease or cancer. And so therefore there are certain subtypes of depression that are potentially fatal. But it's a medical ailment like any other, and that's how you asked me about siblings. I have to go into school sometimes after a classmate dies of a suicide. And how do you explain it to the classmates? And again, we explain it that way. It's an illness like any other. And by the way, it's a little different with children. We're seeing a dramatic increase of suicide among children. Again, don't panic, it's still under 1%, but there's a dramatic increase. It's a little different with children, but there is, so that's the approach we take. But just again, to touch on your question, I want to just tell you, and it's so interesting. I'll go to a family, let's say I do what's called postvention. Postvention is going into a family after, let's say, a parent dies of a suicide. And I explain this all to the children. We go through this all and explain to them that it's genetic and that there's an illness and that, et cetera, et cetera. and I'm exhausted, I'm ready to go home, just about ready to go home, and I've had enough, and there'll be an oldest, let's say 16-year-old girl probably, and she'll say to me, does that mean I'll be suicidal? Does that mean my children will be suicidal? And you know what I tell them? Yeah. You know something? You have to be more careful about your mental health. And you have to be more tuned in to your mood states. And you may have to run to a psychiatrist quicker than someone else will. And you may have to be a little bit more careful if you have a postpartum depression. No different than cancer. If cancer runs in your family, then you're going to get the mammograms at a younger age. And you're going to go for the testing to see whether you have BRCA1 or BRCA2. You know, it's no different. But if you're careful and you attend to your mental health and you make sure that you get help when you need it, you can live to 120 and be a great, great, great grandmother. So it's an illness like any other.
But how do you approach the sibling as far as not, that person may accept what you're saying and trust you with everything.
Right.
But they have to live with their schoolmates.
So we go to the school and we explain the same thing to the school. Now there is a tricky thing with, again, I don't want this to be a whole topic on suicide. There is a thing called the Werther effect. There is a contagion to suicide. So you have to be careful when you go to schools talking about this, because not that it'll be someone who's not also suicidal will become suicidal, but if you know people who have suicidal ideation, they're struggling. It's an internal battle. So if somebody else did, it's a nasa keheter, and they'll be more likely. So you have to be careful walking into. But when this happens, we teach the friends, and we tell them treat him like his brother died of cancer, because it's the same thing. It's the exact same thing. He wasn't in his right mind. He had a brain disease. So sometimes I explain to kids, if you have a disease in your lungs, you can't breathe. If you have a disease in your arm, you can't use your arm. If you have a disease in your brain, you can't think straight. And he wasn't thinking straight. And it's an illness like any other. And they hear it. Kids are great. Kids are really, especially girls. I love girls, much better than boys. But yeah, they hear it. Yeah.
You said to intervene early with kids. How early is early, and how do you differentiate? How do you differentiate between that and overanalyzing your kids?
Can I jump in, because I had a similar question? Do you ever find, because I find with certain times teachers, often just suggest to send children to therapy, and you find that sometimes at a certain age that there's no communication, it's gate-ish, they're just too young and they're just certain.
Oh, okay, that's also okay. So I think it's okay. Two different kind of questions. Yeah, first of all, how do you differentiate? There are parents who are panicking. It's like panicking. They'll right away. The kid has a temper tantrum because he can't have his ice cream before the meal. And is my kid depressed? So sometimes you might have to differentiate between what's normal. But again, we're trained in developmental psych. You can go to you don't have to go running to therapy. You can go to the school psychologist. You can assess. Or by the way, not a bad idea. This is something I push parents to do all the time. Be in touch with other parents in your kid's age. I always tell parents, your kids during recess are plotting to undermine us, and we don't talk to each other. They have us over a barrel. You should be in touch, and so you can say, my kid lately has been throwing tantrums. Are your kids? Or for that matter, sometimes it reflects something wrong in the school. And there's been situations where there was something very bad going on in school settings, and all the kids were acting up, and when the parents talk to each other, they're able to decipher and figure out what it is. So be in touch with other parents. We are trained to know I don't want to go into it now, there are ways to differentiate between what's just a normal developmental kind of thing and what is really a mental illness. In terms of, kids are not going to talk and all that, that's true. So with younger children, you're not going to take a 6-year-old and tell them, why you're acting up in school, you have this thing called ADHD, or or you're acting up in school because your brother was sick and your parents weren't in the hospital, which is not going to make much sense. But there are two things you can do. First of all, a lot of it can be what we call behavioral interventions. We just work with the environment to make it more suitable for him or her, or we do play therapy, or art therapy, or storytelling. There's some wonderful books now. And again, in the bereavement and trauma work that we do, there are a lot of, if you want to try to teach a kid, where did daddy go, or something like that. There's for example, if we want to help young kids with bereavement, there's an episode of Sesame Street where Elmo's grandmother dies, and and through Elmo they learn about people being sad and normalizing it. So there's ways to reach young children if that kind of more traditional therapy is needed. But a lot of the work with kids is, and again, it's not because parents are bad parents, But the parenting for this child needs this type of parenting. All the other kids need a different kind. But this child, we need to approach him this way. This child, we coordinate with the school. And we can do different types of interventions that will work.
But do you ever have situations that behavioral therapy or all these techniques are trying to be implemented and utilized, but it's just, the child just says after a while, like, it's just not.
Oh, absolutely, and physicians have the same thing. They try the normal interventions, they try the normal medications, and the ailment, doesn't get better. So yeah, sometimes we have to throw up our hands, or we can do the best we can, or we need maybe different placement, or something along those lines. Yeah, we're not batting 1,000, but we're doing pretty good. We're not. We have a pretty good. We have about an 80% cure rate in depression. That's good. For a treatment. So yeah, but no, sometimes we throw it, sometimes it doesn't work, and sometimes we're bewildered, and sometimes things are going on. I had a case a few years back of a kid who was wild and out of control, and we're trying everything, and Nebuchadnezzar found out later that he had a brain tumor, and that was affecting his behavior, and it wouldn't have entered our minds. He looked like just an ADHD kid, until finally other elements came out. Okay, my time's up. Okay, thank you.
I mean,
Okay.
if you want to stay and answer questions, that's fine, but
Okay,
if you
sure,
want to go,
sure.
thank you again to everybody that came.
And thank you, Mr. Mashab and Ali, I want you to be remembered well.
I just want to take this opportunity to thank the Kraut family for this wonderful schus for Ovadia ben Tzvi Yitzchak in following the footsteps that he lived by, and really this exponential schus that really takes part really into each and every one of our houses, the chinuch habonim. And I wanted to personally thank Dr. Blumenthal for all of his guidance that he influenced me with, but more specifically in his busy schedule just this week on phone calls with Rabbanim, guiding all of Klal Yisrael and Rabbanim all around the globe how to deal with the coronavirus and all the various issues that come up amongst Klal Yisrael. So thank you very much for all your precious time.
Okay, thank you.
Thank you, everyone.